Assalamu alaikum, dear viewers. When we think of heart problems, symptoms like chest pain, shortness of breath, and fatigue often come to mind. However, the human body can be an enigma, and sometimes our hearts send us subtle signals that are easily overlooked. In this eye-opening article, we'll explore 6 unexpected and unusual signs that could indicate underlying heart damage, shedding light on the intricate connections between our hearts and the rest of our bodies.
Swollen legs and ankles, known as peripheral edema, can be a surprising sign of heart trouble. When the heart's pumping ability is compromised due to conditions like heart failure or cardiomyopathy, it can lead to fluid buildup in the legs and ankles. This happens because the weakened heart is unable to efficiently pump blood back to the heart from the lower extremities, causing fluid to accumulate in the tissues. A study published in the Journal of Cardiac Failure found that over 50% of patients with heart failure experienced some degree of peripheral edema. The researchers noted that this symptom was often overlooked or misattributed to other causes, leading to delays in proper diagnosis and treatment. While coughing and wheezing are typically associated with respiratory issues, they can also be warning signs of heart problems. When the heart struggles to pump effectively, blood can back up in the lungs, leading to a buildup of fluid known as pulmonary edema. This accumulation of fluid in the lungs can cause persistent coughing or wheezing, which may be mistaken for a respiratory infection or asthma. A study published in the American Journal of Respiratory and Critical Care Medicine found that nearly 30% of patients with heart failure experienced chronic cough or wheezing due to pulmonary edema. The researchers emphasized the importance of recognizing these symptoms as potential indicators of underlying cardiac issues. Nausea and loss of appetite are often overlooked as potential signs of heart problems, but they can be indicators of a condition known as congestive heart failure. When the heart's pumping ability is compromised, blood flow to the digestive system can be reduced, leading to a buildup of fluid and subsequent feelings of nausea and a lack of appetite. A study published in the Journal of Cardiac Failure found that up to 25% of patients with heart failure experienced nausea or loss of appetite as one of their initial symptoms. The researchers noted that these gastrointestinal symptoms were often misattributed to other causes, delaying proper diagnosis and treatment. Cognitive impairments, such as confusion and memory problems, are not commonly associated with heart issues, but they can be indicators of underlying cardiovascular problems. When the heart's pumping ability is compromised, it can affect blood flow to the brain, leading to a lack of oxygen and nutrient supply, which can result in cognitive deficits. A study published in the Journal of the American College of Cardiology found that patients with heart failure were at an increased risk of developing cognitive impairments, including problems with memory, attention, and executive function. The researchers highlighted the importance of recognizing these cognitive changes as potential signs of heart disease. While snoring and sleep apnea are often attributed to lifestyle factors or anatomical abnormalities, they can also be linked to heart problems. When the heart struggles to pump effectively, it can lead to fluid accumulation in the lungs, causing breathing difficulties during sleep. This condition, known as sleep-disordered breathing, can be a sign of heart failure or other cardiovascular issues. A study published in the Journal of the American College of Cardiology found that patients with heart failure had a significantly higher prevalence of sleep-disordered breathing compared to those without heart problems. The researchers emphasized the importance of screening for sleep apnea in patients with heart disease, as it can exacerbate cardiac symptoms and increase the risk of complications. While an irregular heartbeat or palpitations can be caused by various factors, they can also be signs of an underlying heart condition. Arrhythmias, or abnormal heart rhythms, can be caused by structural problems in the heart, such as coronary artery disease, heart valve issues, or heart muscle damage. A study published in the Journal of the American College of Cardiology found that patients with atrial fibrillation, a type of arrhythmia, had a significantly higher risk of developing heart failure compared to those with normal heart rhythms. The researchers highlighted the importance of recognizing and treating arrhythmias promptly, as they can contribute to further heart damage and complications. While the signs and symptoms mentioned above can be indicative of heart damage, it's crucial to remember that they can also be associated with other health conditions. If you experience any of these unusual symptoms, it's essential to consult with a healthcare professional for proper evaluation and diagnosis. Early detection and prompt treatment can significantly improve outcomes and prevent further heart damage. By staying vigilant and listening to the subtle signals our bodies send, we can take proactive steps towards safeguarding our heart health.
Thank you for joining us today. Until next time, stay healthy and blessed. Wa alaikum assalam.